Hello, dear friends. Welcome. Today we are going to learn about dosage forms and basically about what are dosage form, what is its need, and classification of dosage form. The objective of this particular topic is that the student shall be able to define what exactly the dosage form is. He will be able to state the importance of dosage form. Student can classify various types of dosage forms. Now let us see what exactly dosage form is. Dosage forms are the means by which the drug molecules they are delivered to the site of action within the body. Suppose this is a dosage form, and when you take in the dosage form, it moves inside your body. So we can say that dosage form it is going to act as the carrier, and once this carrier or the dosage form it moves inside your body, it disintegrates or it allows the drug to move into your different parts of the body. So in this way the drug it reaches to the site of action. Okay, so we can say dosage form is nothing but it is the carrier for particular drug inside the body. Now, what is the need of the dosage form? First is, with the help of the dosage form you can give accurate dose to the patient. Secondly, you can protect the drug. For example, some of the drugs they might get degraded into your gastric environment. So for that you have to go for formulation of coated tablets. Okay, or you can go for sealed ampoules. So in this way you are giving protection to the drug. Next comes protection from the gastric juice. Then you can mask the um, bitter taste and awful odor of the drug substance. You can also go for placement of the drugs within body tissues. You can sustain the release of the medication. You can prepare controlled release medications. You can also go for optimizing the drug action, and dosage form also help for insertion of the drugs into the body cavities like rectal and vaginal cavity. The use of you can go for using desired vehicle for insoluble drugs. So these are the advantages provided by dosage form. Now, whenever you compound a medicine, it consists of two parts. The first one is the drug. Drug is nothing but the active pharmaceutical ingredient or API, and it is nothing but the chemical compound which is intended for use in diagnosis, treatment, or prevention of the disease. Next is the excipients. Excipients, they are inactive pharmaceutical ingredients or technological biopharmaceutical and or stable which are used for stability reasons. It includes diluents, fillers, binders, lubricants, disintegrants, coatings, preservatives and stabilizers, colorants and flavorings. So excipients, as I told you, they include coloring agent, sweetening agent, flavoring agent, antioxidants, preservatives, solubilizing agents, thickening agents, suspending agents, binding agents, lubricants, perfumes, etc. Now, why we should be familiar with the basic properties of dosage forms? The first is API handling can be very difficult or it is impossible in case of doses or drugs which have to be given in very low amount. Okay, then you can also go for accurate drug dosing. Okay, if you want to give accurate dose, then if you are using simply drug, then it becomes very difficult. You cannot handle that small amount of drug. So drug dosing, accurate dosing is difficult. API administration can be impractical, unfeasible, or not according to the therapeutical aims. Some API can benefit from reducing the exposure to the environmental factors, light, which includes mostly light, moisture, or sometimes they need to be chemically stabilized due to the inherent chemical instability. API, it might get degraded at the site of administration. Example, low pH in the stomach is responsible for degradation of n number of drugs. To avoid this, we have to go for dosage form. API may cause local irritations or injury when they are present at high concentration at the site of administration. This is mostly seen in case of aspirin. It causes irritation to your gastric mucosa. API can have unpleasant organoleptic qualities like taste, smell, and compliance. So, for this reasons, you have to go for preparing a dosage form. Administration administration of active substance would mean to have no chance for modification or improvement of its PK profile. Okay, so now let us see classification of dosage forms. The first classification is based on route of administration. On the basis of route of administration, dosage forms are classified as oral, topical. Topicals means they are applied on the skin. Next is rectal. That means the drug has to be administered rectally. Next is nasal formulations. They are to be instilled into your nasal cavity. Next is vaginal. You have to insert the medication into your vagina. Then comes parenterals. Parenterals are nothing but injectables. Then ophthalmic dosage forms and otic dosage form. Otic means they are to be instilled into your ears. The second classification is based on the physical form of the drug. The physical form includes solid nature, semi-solid nature, liquids, and gaseous state. So these are the classification of dosage forms. Thank you for listening.